That's not too bad.
That's not too bad. All right.
Okay.
Hey everyone, this is Nick, and this is Dr. Nelson, where this is our educational wellness hour that we do every weekend, every week, where we talk about various chronic illnesses from a natural medicine standpoint. I'll keep it brief when I introduce Doc. Dr. Nelson's been involved in a lot of schooling and practical hands-on experience to get tough patients better. He is a doctor of pharmacology of the highest extent, coming out of the Indiana and Midwest schools, and used to develop medications and be a consultant for Merck Pharmaceuticals. And then went on to, well, he's done a lot of different things. He's done emergency medicine for 13 years, has been on oncology, gastroenterology, and various other fellowships. So he's done the traditional route quite a bit. And then he went into naturopathic medicine, has had multiple clinics, treated Wade Newton, Suzanne Summers, Chuck Norris, Tom Selleck, his next door neighbor. He's got 7,000 patients underneath his belt. IBS, Crohn's, colitis, Hashimoto's, post-surgery infections, people with HIV, all sorts of cancer, and Lyme disease, mold toxins. After a while, you kind of get to know how the body works, and you start addressing the core issues. The subsequent things that they put into compartmentalized terminologies kind of start to fall away. So if you really want the real solution on getting better, you see somebody like Doc. Hopefully we'll have him for another 20 years because he just keeps getting better and better. He's like fine wine, you know. With age, he just keeps getting better at what he does. It's true. That's really the only profession you really keep getting. I mean, one of the few professions you get better at what you do. So please ask questions halfway through. We're going to be deleting people and keeping people on our Facebook. It was meant as an educational deal, like Doc said the other day. We want people who are going to be engaged at least every couple months. You know, if you're part of our friends list and you get deleted, don't take it personally. If we don't hear from you, we reach out to you, and you know there's no response. We want to give other people the opportunity from other groups, you know, where people have health conditions to learn about what we do and tune in. If I can't add more people on Facebook, or Doc can't either, you know, it's kind of unfair to people who really want it. So that's why we put that out there. But we've had a lot of positive response, so I'm glad we have people tuning in.
What's this? They can't see.
No, they're just tuning in, is what they're saying.
Okay,
Yeah.
right.
So Doc's gonna do some lecturing, and then we want you to start asking questions. We treat people all over the world, thanks to Amazon, because you can buy your own product in there, at least majority of it. And then we treat people throughout the U.S. since we can order all the labs, functional and through LabCorp, assess you over the phone through video Facebook call, and send you a customized protocol and have you check in. I mean, what more do you want? Most physicians, you go into an internal medicine doctor where they have, you know, pharmaceutical, you know, tools that, you know, that don't really address correcting the issues, and they'll give you maybe 20 minutes and they'll do a diagnosis, but that's about it. So it doesn't really matter if it's in clinic or not. If you got something like that, to me that seems to me like a solution. I don't know.
Well, when you're in a traditional system, and my wife works in one, it's not about taking care of the patients.
Right.
It's about running tests and pushing paper. Like I talked about last week, they run up $20,000 in insurance tests. They can't find anything, tell them they're nuts, and they put them on an antidepressant. That's one of the reasons why people are having more and more mental issues today. Dragginess, low energy, brain fog, can't remember. It would be really interesting if someone were pulled over on a reckless driving charge and they actually tested levels of prescription drugs. It would scare the crap out of you. But because the drug companies have such a huge lobby, that's not going to happen. It should, but it won't. I'm going to tell you something that, and this is kind of a fill-in deal because of the patient load, but I'll make you aware of something right now. There is a new paradigm being presented by a Dr. William W. Lee, L.I., and it is called nutrigenomics. What that means is, in many instances, the more drug you take, the more your DNA gets altered. Isn't that nice? So the answer is, in many cases, no drug is better than any drug. He believes, and we do too, and we have whole food substances, which health food stores and other companies don't have, to actually keep re-expressing your DNA instead of developing DNA damage. Now, it's called eat to beat disease. There's only one problem is we don't have clean food anymore. So you really have to get engaged with somebody like me to know what to do. How food affects cells and drugs. Food has 20 to 30 times more horsepower than drugs do, okay, in the long term. You want to be able to increase normal red cells. You want to destroy the bad vessels and the bad cells that cause disease. There's blood that goes to every cell. Now, there are good blood vessels to disease, and there are bad blood vessels to disease. Since I did oncology for a long time, we always talked about the term apoptosis, which means cell death of the tumor tissue. But in order to do that, you have to choke off the blood supply. It has its own blood supply. And we have substances that we're able to do that. So it's very interesting how we've sort of developed that kind of stuff. He runs a foundation called the Aging Genesis Foundation, and I suggest you look it up because I'll talk to him and Horowitz in New York in a couple weeks, and we'll give you a lot more information. But the doctors like me and regular doctors are starting to believe in this stuff because weight gain, cancer, diabetes, heart disease, Alzheimer's, is all based on the formation of abnormal DNA.
What causes abnormal DNA?
Any toxin you can think of.
Can parasites cause that?
Parasites, bad water, bad food, bad air, any one of a number of things. So, bad vessels involved in development, like I said, of Alzheimer's, heart disease, eye problems, ear problems, skin problems, digestive problems, any organ that you can think of. So we have a way now of regenerating the normal vessels that help feed cells versus what we have to do with tumor cells. Completely different. Marjorie, we're outside, so we're talking as loud as we can. When you play it back, turn up the volume. That's all I can tell you. Okay, you can turn up the volume, and that will take care of it.
Right, that will.
So that's a big deal. 70 plus diseases recognized are fed by abnormal red cells. 70 plus. And that is a lot. I'm trying to get juice here. I think we did.
No worries, it's okay.
All right, so you go back through that. Here's what you need to understand. You can't unplug anything over there.
No, that's fine.
So the bottom line is that as time goes along, the more toxins you develop, the more abnormal DNA you develop. Having a little bit of a hookup problem here, but not for long. So that I wanted to mention that. And what he kept bringing up, which most doctors I think of bringing up, is what? You just unplugged the TV, Nick. All right. You need to think about what I do from a functional medicine standpoint, which is a lot of modalities, different testing modalities. Then you need to consume green foods, especially polyphenols, green tea, resveratrol, turmeric, sulfur, etc. You need to understand that the true supplement is in fact your medicine. That's what you need to understand. Okay? Now, we're going to go back through some, all right? So, I think the number one thing I see all the time and more is too many depressed people. How do I say this? They get depressed because their health insurance won't cover what they think's wrong with them. They get depressed because they think their health insurance will. I got news for you. As time goes along, the coverage is going to be less and less, and you're going to pay more and more. The minute you're put on a paradigm database with a diagnosis, let's say diabetes, your premium is going to go up. If they tell you you have a possible tumor in your rectum, but they can't identify it, your premium's going to go up. We tell people, if you want to be...
Donnelly's asking us, this is very important. I'm sorry to interrupt, Doc. Donnelly's asking, what are you chewing?
Oh, I'm chewing mints.
Candies.
Mints. Keeps my blood sugar... Yeah, I'm not diabetic by any stretch of the imagination.
Low glycemic mints.
Yeah, if anything, it's not CBD, it's not marijuana, and it's not a drug. So if anything, my blood sugar is low. When you use your brain as much as I do, you burn up a lot of sugar.
Yeah.
So,
A lot of fats and sugar.
must be preventative. Now, I had a gal Facebook me the other day. She gave me 2 paragraphs of problem.
Nice.
Yeah, just peachy, trying to get through.
He loves that.
One ingredient in a can of Prego spaghetti sauce.
He loves that's all the patients. Those are all the patients. That's super.
And she got very, very snippy with me and said, well, I can't use you because my insurance covers it. I said, okay. I said, since your insurance covers everything it's supposed to cover, how much better are you? She waited 2 days and back and said, maybe 20%. Learn to put money into your own body, because the traditional system ain't going to do it. It's not going to happen.
That's true. That's true.
I have a friend of mine out east that's pretty famous, and I know him, and he said, and I don't know what's going to happen with Obamacare. There's ways to take care of people without Obamacare, but that's a whole nother animal. If you were to spend $400 to $500, not even every month, maybe every 3 months, and do what we tell you to do, you'd be a whole lot better than you are now. And if you don't think I'm right, I've treated 7,000 patients in my life. People that are consistent about their programs get better.
Right.
If you are sick, and when you put you on a program, and we send you everything, and you tell me after 2 weeks you're not better, you're not going to be better. Because some of you are so toxic, just get out of the hole is going to take 8 weeks. You people have expectations from toxicity of your whole life, and we can't go booga and make it go away.
But some people start feeling better.
And a lot of people do, because they do
within a couple weeks.
Do exactly what I tell you to do. I thought this was an interesting thing on feminization, and this brings up people that are gay, and that's a whole nother...
Hold on, I like what Teresa said. Teresa...
pay now, invest in your health.
It's true. And, Teresa, they have a great product that we support. It's the best.
The BioCell. It's good.
It's really good.
You have to invest now. If you're waiting, like my one of my colleagues at Wisconsin said, when you got 1 foot of banana peel and an 80-mile-an-hour wind at your back blowing you toward the grave, it can be too late for you to bail out. You really need to understand that prevention is the key. And men are the worst patients. They're the worst. They lie. They go, well, my prostate's bad for 6 years. Can you fix it in a month? No, I can't.
Teresa and her husband have this product called Liquid BioCell. It's literally, if you want to look younger, they have a lot of people with a lot of surgeons, plastic surgeons. They put people post-operation. They put people on this product. Her skin and his skin, it looks so young. I mean, they look you would never guess their age because they're consistently taking this product. It's one of the few multi-level marketing products that actually we support.
Well, it's
works.
It's actually a form of hyaluronic acid.
It's good. It's really good.
I could tell you this on my forum, my opinion, that actually this formula actually has anti-tumor activity, and the Germans have proved that. Now, I haven't taken myself some for a couple of weeks, and I can feel the difference, so I got to get back on it. But it is a very, very, very good product. Let's go into the climbing problem of the ages, which is too much estrogen. I think I told you this. I had an 8th grade teacher in Michigan that invited her kids to a little school party. Now, I don't know how many kids she had in the class. She might have had 20. And roughly 10 boys showed up and 10 girls showed up. What absolutely surprised her is that the girls look more masculine than the boys do. The boys dress more feminine, and they act more feminine than the women do. What is it? Estrogen and chemicals. Estrogen and chemicals, I'm telling you. And we are over-chemicalized as a result of metals and chemicals. We have way too much estrogen. Way too much estrogen. Oh, man. They act more feminine. You've got to decrease estrogen in kids, and it's difficult. We must try to decrease plastic bottles. Plastic pacifiers are terrible. Fertilizer infestation, most of that is xenobiotic, which is pre-estrogen. Soy, there isn't anybody who needs soy unless you have prostate cancer. Okay. And of course, the murderer, all mall murderers, Roundup. Okay. And Roundup is so dangerous, and it's in a lot of foods. Now, there are things you can take to detoxify your body from Roundup, and we do put people on that. Vitamins must be based on whole food, and they cannot be synthetic. 85 to 90% of the stuff reported out there is full of chemicals, and they are synthetic, and there's no question about it.
Hold on. The other thing I think that we kind of gloss over, but I think is very important is, labs are not everything. Obviously, you got to go off of symptomology, which Doc is very good at doing, but he is very good at reading labs. And I'm talking about labs where he'll tell you what's missing, what markers need to be pulled, and he reads in between the lines. Just because it's not out of range in traditional medicine doesn't mean in naturopathic medicine that it's not out of range.
Well, chemistry is a marker, and here's what I learned in Germany, okay? That's all it is, a marker. Blood chemistry is 20% of a diagnosis at best. It's the doctor that can read it and know how to read between the lines, and that's what I was trained to do. So that's a major, major issue. And yet we do the panels on you, we can do a lot of things. In the next couple of weeks, we'll talk about the genetic snippet test, which I recommend everybody do. It's a one-time $500 investment. It's going to pick up every gene error and what to do to repair the error. It doesn't mean we're going to repair the gene, because if anybody's been on any number of medications, the gene doesn't express. But there are things you can give them so they get normal expression of normal DNA, not abnormal DNA. And we're the only people that have that test, and it's a saliva test. Once you send it in, it takes about 6 weeks to get it back.
Cynthia says, how much is the appointment now? Our appointment right now is $140, and what that includes, essentially, Doc will go over your symptom and medical case history. If you have some simple blood, he'll look at that. If it's very complex and there's a lot to it, that's an additional $75. We'll also, part of that also includes you checking in while you're on the protocol for the month and going over what's working for you, what's not. We possibly would redose you and take certain things out. So, and Doc, how many doctors will take time to actually return phone calls steadily throughout the month? Most of them get too busy and they don't want to pick up the phone. You got to chase them around. So that's not the case. That's included. And you know, the protocol typically, generally, what I see from a accounting standpoint, I see it fluctuate, but between the time Dr. Nelson's time and assessment for the month and the protocol, it comes out to be around, I'd say conservatively, median average about $500. So if you can afford that, now mind you, most naturopaths work half a season as doc, they're easily charging $350 just for their consultation time. And they do not have a practical approach. It's an academic approach to getting better.
See, mine is unique in that it's both traditional and non-traditional. And most people are not. I'm really not a naturopath per se. I mean,
Right.
I'm called a naturopath. But I both trained in traditional and non-traditional medicine and all the subspecialties of that.
Thanks, Peter. Kika says, Doc calls regularly and cares.
That's true.
That is true.
That's my brain's beat up. So,
Yeah.
Do we have any questions here?
We're gonna have to quickly pause it and to save it and go inside.
Really?
Yeah, because we're running a little bit low on juice on this cord.
Well, I don't know where you're going to set it up at that
In
table.
there. So hey guys, stay tuned. We're gonna reconnect here in a little bit. I'm gonna go ahead and put this one on the Facebook here. Hold on. Stay tuned.